Hey, everybody. Welcome to the Home Care Forum podcast. Thanks to Glad Health and the Home Care Show for allowing us to do this live taping. It's very exciting for us to be out in front of some of our listeners and those who are not familiar with our podcast to get actual feedback right away instead of just the emails and calls and messages that we get directly, so we can engage with you. And again, follow us on YouTube. We are on Patreon as well, and we thank those who are supporting us that way. We launch or post on LinkedIn, so you can find us there.
So for those of you who have not listened to us in the past, here's what we do on the podcast. I'm a home care attorney, and we talk about all of the legal, regulatory, legislative developments and business developments, right? Because there are a lot of business things that happen outside of what New York State or the feds are telling you. So we bring those issues weekly to you. I bring the legal perspective. If we think that some litigation should be involved, I will talk about that. Sasha here is a business owner, and I'll let him tell you a little bit about who he is and what he does, but he brings that provider perspective to our discussion. And sometimes we have guests who come and present on subject matter expertise. So for example, we will have different vendors, Best Medical, for example, Navan, Glad Health, will come and talk to us about what they do for the home care community and the expertise that they bring. But most of the time, it's him and I just talking about what's happening and our own opinions, uncensored.
Right. Well, we edit that stuff out that can't make it. And if you're interested in being on the podcast, just reach out to us. It's a no got you kind of a thing. We will edit out. You tell us, hey, I misspoke here. Take this out, and because we want to engage in a conversation, bring these topics that are not discussed on a regular basis. We know we go to conference, and that's an opportunity for us to get together and discuss. But on an ongoing basis, there are things that help us build up to the conversations that we do have at conference in these larger settings. And among that, we'll talk about our guests here.
So I will make a little plug for the guests on the podcast. We regularly have vendors come in and talk about their subject matter of expertise, but we would love to have more provider guests who will talk to us about what issues they're facing, right? But a lot of providers are very hesitant to come on. So maybe we think about having a guest who just appears in voice. Sasha is the more technically inclined one, so he could probably obscure the voice. We won't say who it is, but it could be a provider, who comes on the platform to just vent. Like, New York State should do this. How dare they do that? And we could talk about...
Well, yeah, and so we've had guests on that did blackout, and they didn't go video live, and actually...
But we still say who they are.
Yeah, well, we could, or we could not, right? We'll do whatever it is that you need to do, but I actually wanted to speak to this, the fact that I think we do need to get ourselves out there, and maybe
as providers, you mean?
Yes, as providers, because if you are a constituent of the politicians, the assembly members, the governor's office, and I think we do need to have a voice in there as providers and cut through and be directly in front of them. If you are concerned about that, that's why there are associations like Fair Access Initiative. We'll pivot to that in a second. But even with that, Fair Access Initiative is a provider-based association, and we've been engaging with the politicians and telling them, hey, this is what's going on in the industry. This is how we're feeling it and reacting to it. And the one-to-one direct conversations have been encouraging thus far. So with that said, I'm going to pivot and introduce Zev Spiegel. Zev is known in industry. He is the COO of At Home Solutions and a founding member of Fair Access Initiative. Zev is about 10 years in the home care industry. And we can go to the background of how we started this conversation, which was around March 31st. If you remember, that was the end of CDPAP, right? So that was the impetus for us trying to figure out how to do something different. I won't steal his thunder. I'll fill in the gaps where needed, but let me introduce to you who don't know, Zev Spiegel.
Thank you, Sasha, for the introduction. I didn't know I could be blacked out of the podcast.
You could.
But Sasha warmly invited me to join this session and present a little bit about what we're working on together with the Fair Access Initiative and as a provider, like many of you in the room, in the home care space here in New York today. Like Sasha said, our conversation started around the end of the CDPAS program as it was prior to PPL going live. I think the big takeaway that we both had, and since then many people that we've spoken to, was that the reaction of the industry to PPL and to the end of CDPAP was a lot of anger, a lot of energy, but we didn't really focus it, and we didn't find ways to get a productive, clear, sharp response to the issue together with the state, as opposed to taking on the state. So what we're looking to do is see if we can help reset that relationship and reset the way we approach the regulatory environment we live in, our legislators, our governing authorities, whoever they might be in different areas, and see what we can do to engage with them. Yes, put a face on it, get up on stage once in a blue and do what we have to do as providers to be able to speak about the things that matter, to make an impact on the things that matter, and hopefully we could do things a little differently and hopefully have a little bit of a different outcome from what we've had in the past.
Great, thanks, Zev. We're going to make one more introduction for Alyssa, and then we're going to pivot back to Emina for her take on the industry and where we are today. Right? So, Alyssa Lovelace, for those of you who don't know, she is currently a lobbyist at Gosdek, McGraw, and Nemeth. She is 18 years plus in the home care and healthcare space at multiple associations. So we definitely value her opinion. And when we brought Fair Access Initiative to her, she jumped on and was very helpful in our developing our thoughts and our policy positions. So, Alyssa?
Thank you, and thank you everybody for having me here today. This is my first time at a home care show, and it's amazing, mind blown. I am really excited to be working with these guys in the Fair Access Initiative. I think now is the time for providers to get to Albany, talk to your legislators. We saw what happened last year with CDPAP. We've seen the multiple proposals that come out in the budget, what seems to be every year, and home care usually gets the short straw, right? So how do we come to the table and be proactive, not reactive? And I think that is our goal here as an association.
All right, so now that you know who is sitting on this panel, let's get back into kind of the regular swing of the podcast, which is we talk about what's happening. And for purposes of today's recording, we're going to paint a broad brush. Sasha and I will kick off the conversation. We're going to talk about the industry and some things happening. And then the second half of the show today, we're going to talk about the FAIR Initiative and what this team is doing with their agenda, and they'll lay all of that out and how providers can get involved. So I was telling someone earlier that it feels like it's conference season, right? So a lot of folks today I've had the pleasure of seeing at the last few different home care events. But what's happening back at the office, right? What's happening in the industry? And I'm sure you've heard from Al Cardillo yesterday. He was talking about the home care industry generally as well. From my standpoint, because I have a different view a bit, right? As a lawyer, not so much as an advocacy person, I'll talk about the things that I'm hearing from clients. Number one, a number of them are sick of talking about CDPAP. Okay, so I will talk a little bit about it as well, but a lot of folks have moved on. And at this point, it seems like it's about survival, because the market is getting tighter and tighter. There are still quite a large number of providers. The MLTCs are getting consolidated, And it's not a monopoly per se, because there is more than one in the market, but there are enough large players that they have the right really to control the pricing. And so a lot of providers are getting cut from plans that they've worked with over a decade. Most MLTC contracts do allow a no cause or no reason termination. And I hear a lot of, well, how can they do this? We haven't done anything wrong. We've worked with them for 10, 15 years. We've built their entire book in this area of the state, whatever that area is, right? I hear this on a pretty regular basis, at least once a week. There is some contract that will either cut or significantly reduce the rate on a take it or leave it basis. And the provider is left struggling on what to do. So a lot of providers try to figure out how they can preserve the caseload. And where can we move these patients? I cannot name specific names, but we know what MLTCs we're talking about, right? And if any of them are in the room, it's nothing personal, folks. You may have received a threat to sue or a cease and desist letter from me. It's your bosses that I'm sending it to, okay? Not you. But the provider is really left in a bind when these things happen, because the contract does allow the MLTC quite a lot. And what has worked for you in the past, that relationship, you know, inviting their business person to your annual fundraiser, taking them out to dinner, you know, connecting them with your intake team, that closeness that you have worked for so many years to establish, it just doesn't work when you're working with a national player who is just looking at the bottom line. It's very, very business oriented. And I can't even say that many of them care or have awareness of the potential ramifications with New York State, because New York State is asleep at the wheel here, right? A lot of providers will tell me, well, you know, can we file some sort of a complaint with the state? And say what, right? Just because it's mean to do this doesn't mean that it's illegal or that the state will spend any of its limited resources to help you. In fact, you know they won't. If you have actually reached out to them, and a lot of providers don't want to, you know that they don't really do anything with this. They say, go negotiate with them. Go figure something out. So they're of no help. So I guess I want to talk a little bit, Sasha, with you, because you are a LHCSA owner. You had a standalone FI as well. You have a number of other business ventures in the home care community-based continuum. I want to kind of turn over to you to, I expect, mimic what I have just said, which is it's a very difficult price-wise market out there.
Yeah, this is where the advantage of being on a podcast away from people would allow me to vent a little bit, and then we'd edit out, because, yeah, I mean, this is, we all know where we are, right? How many times has the Department of Health showed up to these conferences and said, hey, contracts are private, private negotiations, it's a private contract, we don't get involved, while they are well aware of cost reports, statistical reports, and what it takes to run an agency. So, Al spoke about it a bit yesterday, that he said that the state believes that the reimbursement, the capitation that they're paying the MLTCs already covers the minimum wage increase. All right, so who believes that to be the case? It may be the case that the MLTCs reduced our rates this year and maybe some last year, so that they can give it back to us and say, hey, here you go, we gave you an increase. Not taking into account, hey, you just put us in this position, right? That's what Amazon does, they say, right before Black Friday. They raise the prices to then reduce it, and it costs the same, right? This is this in reverse from the MLTCs. And look, that's what starting this new advocacy, we won't hesitate to say what is what. And we'll work with the plans where it's necessary, right? And because when the state was going after the MLTCs last year, and they sent everybody here a letter asking for support, and some people signed it, and then they beat it back, and then they pointed to figure out CDPAP. I don't recall seeing a letter from us going to them saying, hey, we need your support to help us kill this thing, right? Those are the conversations that we need to have. Our industry is very weak right now. And we, as far as I recall what happened with the nursing homes, they were kind of beat back a decade or so ago, or maybe even longer. But they've been coming back. They've been reinventing themselves and being and organizing politically. We need to do something, right? Because we met with the governor's office, Division of Budgets, Blake Washington, point blank to our face. No, they're coming for more. They're going to cut us again. So my being here as an agency owner and putting my face out, because I'm going to lose my business. I already lost CDPAP. I went from one of the first 62, but the industry fought that. Okay, we got 128 or whatever it was. We fought that, and then we got nothing. So we need to be smarter about our approaches and our working with the legislators. I'll stop here.
Let me just go back to the idea that we started out with, which is the pricing and the monopoly and all of that. There is a new minimum wage coming in January. I'm sure you're largely, most of you probably are aware of that. The wage parity rate for those of you downstate folks is staying the same. So it's still at $1.67 and $2.54. I cannot believe how much confusion there was about that this January. So just to put that out there. As far as what you said about the MLTCs and the state believing that the minimum wage is built into the capitated rate, that is correct. It is built in, folks. It is built in. It's just that the MLTC is keeping a lot of it for themselves, for these administrative costs. And all of the lobbying that the home care associations have done so far to increase that transparency, to shift some of the bargaining power to the providers, to create legally statutory obligations to pass at least the minimum wage down to the providers, those have been defeated because the lobby for the MLTCs is extremely strong, all right? It really is. So it is not for lack of trying. These efforts have been underway for many years, but the MLTC lobby is extremely strong, smart, cunning, and they are in the rooms where they need to be. There are so many more providers in the home care space, but you all operate, again, this is just my perspective, you all operate kind of in your own silos. You do not march with one voice, and you need to do that. And it's always, oh, I will let someone else pay for it, or someone else speak on my behalf, or I don't have the right look to be out there, right? Because the state already thinks everybody out of Brooklyn is bad. Everybody who is Jewish is bad, right? So they're like, I'll let someone else fight it. I don't have the look to be the soldier for this cause. I think the time for that, for those types of ideas has come and gone. If you want your business to survive, you have to take a more proactive approach. The other point I want to make about MLTCs, I sue a number of them on a regular basis. I am litigating, I'm litigating with them regularly. So here are some things that I can tell you that I see, especially with these large national players. They pick large law firms, but not very smart lawyers who actually know how billing or EVV or the industry or coding works. And so they will kick your claim down the line as much as they can. There are a number of limitations on when you file a claim. So if you think you can just go back and forth with their account managers for years, be aware that they may be sucking you in because your statute of limitations to sue for that amount could expire on you because you're going back and forth because you're so concerned about keeping the relationship you've been building. This is business, this is money. If you're not getting anywhere with their claims rep in a relatively quick time, you need to look at your contract. You can either sue them, or you have to go to arbitration, or you have to go to mediation. But you gotta commence something, otherwise you're definitely gonna be squeezed out and your claim will be time barred. And these numbers add up quickly. You have rights to interest and attorney's fees under New York law and under some contracts. So it is not a mom and pop shop conversation anymore. These are big plans. They have huge legal departments whose strictly job is to leave some money on the table. And they are counting on you on walking away. Can you just imagine how much money they save by agreeing to pay you 70 cents on the dollar, and so 80 cents on the dollar, and so 90 cents on the dollar, right? They budget for a number of you to take a cut. But are you really in a position at this point to be taking cuts on your bills? Because you're already getting pennies. It's always been a pennies business, and that is even more true these days. Let's talk a little bit about unemployment insurance and how New York State has wonderfully paid off its debt to the federal government only to turn around and then increase the benefit amount. I mean, I assume you all know that, right? You are getting my newsletters, I hope. So you know that pretty number that makes it worthwhile for an aide to go on unemployment more so than work for you. What do you think about that? Have you actually seen that in practice at this point?
Well, thanks for setting up the conversation we just had offline. And look,
Did you cool down since that time?
No, I have. Look, yes, it's like I can take off my business owner hat and my progressive thinking and say, great. I think New York is an expensive place to live. And the rate of that you're reimbursed or paid for unemployment is not an amount that people could live on, which is partly purposeful, so people will go back to work. Okay, I understand, fine. But to have a press conference where you're announcing that we paid off this amount and that you taxed employers to be able to fund, and then not turn around and give that reduction back to the providers, and then just saying, hey, we're going to up the reimbursement. From a provider perspective, it's a bit of a smack in the face because you asked us to fund it. Okay, fine. All right, progressive, I'll take it. But then, for me, this past week, to then get an additional dollar amount, I think it was like $8,000 or whatever, a bill, saying, hey, you need to pay this for the taxes that we just paid off. Hey, I thought you said you paid it off. So for you to come back to the well is maybe you're looking for a way to fund this mandate that you just put out. It sounds great politically, but for us as providers, you know, every penny hurts, and your employees don't necessarily see the pain that you're going through. And look, when you're being reimbursed at a rate, and then mid or first quarter or second quarter you cut that rate, where's that money going to come from? Right? Like, I don't know how many years we've had to take out personal loans or dig in personally to cover. That's what we signed up for as business owners. But they're not really considering us at all in Albany, and it shows in the decisions that they're making, which goes back to we are very weak as an industry.
So I guess before we leave this topic and go to the next one, as far as the unemployment stuff is concerned, I'm sure you all hear a lot about creating your company story, not only for recruitment and retention purposes, but for these purposes as well. Because if you do find the courage to go to one of your elected officials, you want to be going to them with a story. We are, what is your story? We are a minority-owned business that was started by my mom, and I was working and helping her since I was 16, even going so far as driving some aides. And we love being an employer that's been in business, 30 years at this point? Your mom's owned Mrs. G's, right? And how wonderful it is that I can be her successor. And now my son is working in this business as well. We are continuing to have a company that employs hundreds of home care workers. We have a pension, like a retirement plan, all of that. But you all need to have a story. You should not be afraid of going to your elected officials. They should absolutely know who you are. Now, look, I work with a lot of businesses that whose employees are represented by 1199 or one of these other unions, right? A lot of people are afraid of the unions. What are they at the end of the day? First, well, they're very powerful in Albany. Let's put that out there. But they are great storytellers, all right? They are the ones who go out there and say, we provide good wages and we secure retirement and health insurance benefits for these workers. And we represent so many of them. They are an outside third party who doesn't know your business, who does not know your employees. They get fees on a monthly basis to speak for those employees, right? So those employees hire the union to speak for them. But if you spoke for your employees and you had a good story and you were a good employer, your employees would realize they are paying dues for nothing, all right? So the best anti-union campaign is to do what the union is doing that they really shouldn't be doing. If you as a business listened to your employees and provided back what the employees wanted, there would be no need for a union. And you're free to tell your employees, why do you need a union? We're doing everything for you that you may possibly need. Or you're free to say, if we're not doing it, it's because we can't. And you need to have a bit of a better story than the Department of Health is not reimbursing us enough. But my point is, you need to have a story. You need to have a culture of caring. At the end of the day, it's not just in CDPAP that the workers bring you the cases. It is the workers as well. So you do need to spend some time on them. And a lot of this legislative policy centers around workers. Because what are workers? Workers are taxpayers too, and they vote. So invest in the workforce, not just because you need them to service your patients, but they really are the bloodline of this business. Get to know them, right? For the longest time, home care has operated as a staffing agency. These people come in, they sign up, and you never see them again. You can't treat people like that, right? Get to know them, find out who, and don't just leave it all to the coordinators, right? Because the coordinator leaves and just takes everything with them. I can't tell you how many lawsuits I have because a coordinator or a marketer left and they took 400 whatever cases with them. Why would you ever, as a business owner, give that much power to someone in your company? Get to know your staff. They should know who you are. And everybody in the C-suite should be known to the employees.
With that set up, we want to talk about a possible solution and a different approach that Fair Access Initiative is proposing to the state, and also inviting providers and vendors, anybody along that's active in home care along the continuum, vendors, so on, to engage in, because this is the industry that supports what you do on a day-to-day. So why don't we, Zev, take over now and go through some of these proposals and add whatever you might want to.
Thank you, Sasha. Thank you, Emina, for a very clear run-through on what we're all looking at coming up in 2026. Several different interesting topics that we should be considering as providers and as an association, how we can support and help on these topics. The first thing, just Alyssa, as a note, Sasha, our progressive leader over here, I'm pretty sure we've been meeting with quite a few people across both sides of the aisle. And I think an important piece, piggybacking on what both Emina and Sasha were talking about, as providers, getting out to Albany, getting out to the different state senator, assembly people, whatever it is, their offices, sitting there talking to their teams, like Emina said, bringing them the story of, I think this week or last week we were just on with one of a senator out of Lockport, New York, talking to them about what it means to be able to staff and support their team where they need to be. That's the type of flavor we want to be able to bring to advocacy, which is we're not just the smaller cousin to the MLTCs and to the plans. We want to work with them as well. But as providers, we can't just be those staffing agencies that, don't understand or take care of our patients and our caregivers. We are the ones out there that really understand what it means to staff a Lockport, New York, to go in, take care of patients here in New York City. Long Island has its own set of challenges that they've been facing, whatever it might be. Bringing those stories forward and communicating them clearly. We might not have as deep pockets as some of these other industries or players in the game might have. But at the same time, we can definitely bring a story, and we can also be very clear about the impacts on the ground and what they really mean to patient care, to the caregivers. Like Sasha said, there's definitely a progressive lens we have to take. We're in New York. It's always going to be a labor first state. We can support that, working to practical, real solutions that we can help those caregivers. I think we were talking about unemployment before. Some of these home health aides are going to resign because they'll get more money with unemployment than they would be getting with, a paycheck. That's going to lead to serious staffing issues for us. All these are things that we would like to be able to take on in an intelligent. I don't think we're doing anything brilliant. We're not trying to come up with anything crazy. It's just be determined, be clear, speak with one voice for the industry, work with all the people around us, make sure the state understands the impact of what they're doing, and come to them with concrete things that we can do to help them.
Okay, so why don't we go through some of these proposal ideas that we've met with the state on and are going to be following up hopefully in the next couple of weeks.
Sure. So I think actually one of the first one I would like to jump on, Emina laid us up very nicely for this, is reimbursement. We definitely have minimum wage coming in with an increase this coming year. Wage parity is not coming down. We have our partners in the MLTCs who are making sure that they're going to be okay, and there's nothing blocking them from cutting us or keeping us where we are today in terms of reimbursement. One of the things that we're already talking to the state about is how can we ensure that providers like us have a floor around minimum wage? And Sasha, do you want to jump in a little bit to where we're going with that?
Yeah, so if we step back, and Zev talked about New York is a progressive state. They want establish higher minimum wage and living wage. If that's what you want, fine. Just make sure that we're reimbursed at a level that we can meet this mandate. So that sets the floor for our conversation, right? And then if you do that, and then we look at the rates that the MLTCs are being paid, we want to make sure that that money passes through to us in a way that we can, again, meet this mandate. This is one of the proposals where it seems as if we're asking for monies and funding, but that's not the start of the conversation, because we start at looking and analyzing the industry as is, looking for duplicative services and areas where we can cut and streamline so that it's both efficient for us and we can identify savings as providers. And just and I'll just throw this out as an example and for simple math, if we're able to find $4 in savings, okay, we'll give you $2 back, we keep $2, but we streamline the process, and we'll go into what that looks like a bit, because the proposals that we've analyzed, we've identified from publicly available information about $1.5 billion in possible savings, and the governor's office and the division of budgets, they definitely like that number. So let's kind of flush out some of this. And this is a conversation, right? This is not us coming to you and saying this is the ultimate solution. We have spoken with the other associations and looking for ways we can collaborate with them. And we will continue those conversations where we align, we will do so. But if there are ideas that we want to push for the shorter, medium, or long term, we're having those conversations. And this is part of us coming out and sharing our ideas. We do have white papers on this that details this out, but...
So let me get this straight. You have an association, you formed it. It's a provider-focused association.
Correct.
Because you've talked about the FAIR initiative, but I just want to make sure folks here have heard it correctly.
Yes.
So it's an advocacy group association.
Correct.
Membership-based.
Correct.
And your goal is primarily to get in front of the elected officials and affect positively, hopefully, results are never guaranteed, right?
Correct.
Positively affect the laws impacting what? LHCSAs, CHAs, FIs?
We are LHCSA focused,
Okay.
right? And we are provider based. We are looking for members. From the LHCSA perspective, I can get in front of the legislators and advocate on behalf of the industry myself, but more people involved, the better, right? And then what the other areas that we need your support on is so that we can expand our reach into the workers and the patients. Because if we build on what CDPAP did well, is that they did get the patients out, they got the workers out, and that made a difference. So we'll build on that. Right? They're no longer functioning the way they did. Okay, so let's learn from, and let's continue the advocacy.
I was just going to say that's the grassroots advocacy piece of all of this, right? So you have your lobbying 101, you're going to go to Albany. We can do that on, our membership's behalf, of course, but really bringing in the providers, their patients, their families, the workers. Those stories are just as, if not more, important than the ones we just going around in the halls are telling.
Right. There's two proposals that we met with the governor's office, and they asked us to come back to them with. And one of them is the integrated ecosystem for services, right? Where you look at when you're onboarding a case, there are nursing assessments done by Maximus, the UASs. There's nursing assessments done by the MLTCs. There's nursing assessments done by the LHCSAs themselves. Why couldn't we develop a universal assessment, streamline the process, so we're not having these duplicative services? And therefore, if the end result of something like that is that there's less nursing or clinical services being done by the agency, and that reduces our expenditure, we could share some of that back with the state, right? Simple as that. We have the PACE programs and we have the MLTC programs. From a PACE perspective, agencies basically, we provide the care, and the care management is being done by the PACE program. That is a very streamlined, hyper-focused, this is what we do as home care. On the MLTC side, we could mimic or duplicate the PACE model by adding wraparound services, right, along the continuum. You build, you bring a health home, you bring care management teams, you involve primary care, and really streamline the process so that we eliminate the duplicitous services and we can reduce the expenditure that occurs from the Medicaid perspective. I want to also talk about the centralized workforce ecosystem. We've talked to the unions about this as well. We've talked to some private companies who are doing some of this, and that got some traction from Albany. The idea is that if you have an aide who works at multiple agencies, that aide has to go and do in-services at multiple agencies. Why couldn't we have that centralized, right? You could have the aides just go to a contracted entity and have that in-service done, and you're building on the home care registry, you're building on CHRC, the data is centralized, and the aide just has to do it once, and we just tap into that. Now, the history of that is agencies, but I'm paying for and somebody else benefits from, right? So instead of thinking that, let's work together and figure out a solution. So in that, we thought, okay, so if you had a contracted entity, whether it's the union could do it or a private company does it, and then they put the information and we tap into it. We still have to do orientation, right? There's a piece of it that we're still responsible for. Okay, how about the fact that the aide get paid per hour for? Okay, we have jury duty. The state pays for when somebody goes to jury duty. We can tap into something like that and find a solution where the state takes care of it. So now all that HR responsibility, the HR compliance is out of our office. The state takes care of it, right? By contract, whether the union does it or, right? So this is a level of creativity, and in presenting to people, there's there's other things you didn't consider, you got to consider. So we'll continue to do that, but we need members, we need people who are much smarter than us at the table to fill in the gaps of where, but the reaction that we've gotten from the governor's office is, oh, okay, we didn't consider that. This is something we want you to come back with, and that's what we're doing. So that's what our association, we're going for the big swings. We're, they're not looking for tens of millions of dollars. They're looking for hundreds, if not billions. And, that's what we have to do. And I think we can do it in a way that protects our industry.
Just to add on, and closing for myself, and I'll hand it to Alyssa to close, but everything Sasha's saying over here is that the state, and we met with the governor's office, and sitting and talking to them, they're definitely looking to cut. We can't avoid that. They have a very significant budget hole they need to fill, and labor's not going to be the answer. They're not going to go and cut minimum wage to get there. It's going to have to come from somewhere. For them, and we haven't even touched on, is there's still LHCSA RFO officially law for several years. It's going to come for us if we don't find a more creative way to bring savings to the state. What we're focused on is what can we do, whether it's on the clinical side with the nursing assessments, whether it's on bringing more federal funds in through a PACE, helping the MAP-type products where we bring Medicare funding to the state, very significant savings there, whether it's on centralizing the HR functions, taking cost off of our plate, which we can then pass back and see how that works in terms of we've saved you money, we could eliminate the LHCSA RFO and any savings you thought you'd get there, and maybe even solidify that minimum reimbursement that we need to be able to do what we do best, which is take care of those patients and give those caregivers the jobs they need to be able to keep doing what they do, taking care of the patients. So that's what we're looking to do. Reach out to us, talk to us. We're looking forward to having all of you join us and working on this together.
I just want to say that 2026 is going to be a big year. It's an election year. And politics and policy, unfortunately, do go hand in hand. So now is really the time to engage your lawmakers now before the legislative session comes about in January. We are going to be in there, obviously, but we would love to have, there is power in numbers, so the more of you there are, the better. And then, of course, as we develop continue to develop our home care legislative agenda, we want your buy-in. This is a provider-led advocacy association, so it is incredibly important to have the providers, members at the table when we're negotiating with the state. I can help you develop your stories. We can help you with that. And, we're here as a resource for you and to the state. This is a partnership amongst all three of us. So,
thank you, everybody, for engaging, or hopefully you do engage us, both in the podcast and Fair Access Initiative. Thank you, Zev. Thank you, Alyssa. Thank you, Mordecai. Glad Health. Healthcare Consulting for having us. Emina, as always, everybody likes hearing from you more than me. This has been the Home Care Forum podcast with your hosts, Sasha, Guillaume, and Emina Poricanin. Have a good one.
Thanks, everybody.
And a little heckler from this side.